What if I told you that two of the biggest threats to your heart, high blood pressure and insulin resistance, are often silently working together in the background? Millions of people are living with one, unaware that the other may be fueling it. This dangerous partnership doesn't always cause obvious symptoms, but over time, it quietly damages arteries, stiffens blood vessels, and increases the risk of heart attack, stroke, and kidney disease. Hypertension, known as the silent killer, affects the force of blood against your arteries. Insulin resistance, often a precursor to type 2 diabetes, affects how your cells respond to sugar and energy. When these two collide, the impact on your cardiovascular system can be devastating. In this video, we're taking a deep dive into the hidden connection between hypertension and insulin resistance, why they're linked, what this means for your health, and most importantly, what you can do to protect yourself. Disclaimer: this video is for educational purposes only and is not medical advice. Always consult your healthcare provider before making any changes to your lifestyle or treatment plan. What is hypertension? The silent force pressing against your arteries. Hypertension, more commonly known as high blood pressure, is one of the most widespread health concerns in the world. It's called the silent killer because it often develops quietly with no clear symptoms until it has already caused serious damage. For people over 50, hypertension is especially dangerous because arteries naturally stiffen with age, making it harder for the heart to pump blood efficiently. How blood pressure works. Blood pressure is the force of blood pushing against the walls of your arteries. It has two numbers: systolic, top number, pressure when the heart beats; diastolic, bottom number, pressure when the heart rests between beats. A normal reading is around 120/80 millimeters of mercury. Hypertension is typically diagnosed when readings are consistently 130/80 millimeters of mercury or higher. Why hypertension is dangerous. Strains the heart. Constantly high pressure makes the heart muscle work harder, which can lead to enlargement and eventually heart failure. Damages arteries. High pressure weakens artery walls, making them stiff, narrow, or prone to rupture. Raises stroke risk. Fragile blood vessels in the brain are more likely to burst or clog. Affects the kidneys. High blood pressure damages small blood vessels in the kidneys, reducing their ability to filter waste. Impacts the eyes. Tiny vessels in the retina can be damaged, leading to vision problems. What's happening inside the body? Arteries lose flexibility and thicken, forcing blood through a narrower space. The heart must pump harder, increasing strain. Over time, this cycle accelerates aging in the cardiovascular system. Example: a 65-year-old with untreated hypertension might feel completely fine, yet silently accumulate artery damage that increases the risk of a heart attack or stroke within a few years. Common risk factors: age over 50, high salt intake, sedentary lifestyle, obesity, family history, stress and poor sleep, medical conditions like kidney disease or diabetes. Why monitoring matters? Because hypertension rarely causes symptoms like headaches or dizziness, many people don't realize they have it until it's severe. That's why regular blood pressure checks are crucial, especially for seniors. Hypertension is more than just a number on a blood pressure monitor. It's a silent but powerful force that strains the heart, weakens arteries, and raises the risk of life-threatening events. Understanding it is the first step in protecting yourself, and it's also the key to seeing how it connects with insulin resistance. What is insulin resistance? To when your cells stop listening. Insulin resistance is one of the most important, yet often overlooked, health conditions that quietly affects millions of people worldwide. Unlike hypertension, which you can detect with a simple blood pressure cuff, insulin resistance works more subtly. It develops slowly, often years before someone is diagnosed with prediabetes or type 2 diabetes. And here's the catch: even without diabetes, insulin resistance can damage your cardiovascular system and increase your risk of hypertension. How insulin works. Insulin is a hormone made by the pancreas. Its main job is to act like a key, unlocking your cells so they can absorb glucose sugar from the blood and use it for energy. After you eat, insulin levels rise, helping move sugar from the bloodstream into your muscles, fat, and liver cells. When you're insulin resistant, your cells don't respond well to insulin signal. It's like the lock has become rusty, the key still fits, but the door won't open easily. As a result, sugar builds up in the blood, forcing the pancreas to release more and more insulin to keep things in balance. Why insulin resistance is dangerous. Higher blood sugar levels. Over time, this can lead to prediabetes and type 2 diabetes. Increased fat storage. Excess insulin encourages fat buildup, especially around the abdomen. Inflammation. Chronic high insulin levels trigger inflammation in blood vessels. Artery stiffness. Insulin resistance damages the lining of blood vessels, reducing their ability to relax and dilate. Hidden risk. Many people live with insulin resistance for years without knowing it. What's happening inside the body? Muscles don't absorb sugar properly, leaving it in the bloodstream. The pancreas works over time, producing more insulin. High insulin levels encourage kidneys to retain sodium, which raises blood pressure. Fat stored in the abdomen releases chemicals that worsen inflammation and vessel damage. Example, a 55-year-old with no diabetes symptoms, but who carries extra weight around the belly, may already have insulin resistance, raising risks for hypertension, heart disease, and stroke, even if their blood sugar tests still look normal. Early signs and risk factors. Fatigue, especially after meals, increased waist size, abdominal obesity, difficulty losing weight, high triglycerides or low HDL cholesterol, family history of diabetes or metabolic syndrome, sedentary lifestyle, age over 45. Why it's hard to detect. Unlike hypertension, insulin resistance isn't easily measured with a home device. It often requires blood tests such as fasting glucose, insulin levels, or HOMA-IR, and sometimes it's only suspected based on risk factors and lab results. Insulin resistance is like a silent malfunction in your body's energy system. Your pancreas keeps producing insulin, but your cells stop listening. The result? Higher blood sugar, higher insulin, and a chain reaction that harms arteries and raises blood pressure risk. Together with hypertension, it forms a dangerous partnership that silently damages the heart. The hidden link between insulin resistance and hypertension. Why do high blood sugar problems and high blood pressure so often go hand in hand? Doctors have long noticed that many people with insulin resistance also struggle with hypertension. In fact, the two conditions often appear together as part of metabolic syndrome, a cluster of risks that dramatically increases the chance of heart attack, stroke, and type 2 diabetes. But why does this happen? The answer lies in how insulin resistance changes the way your body handles blood, salt, and stress. How insulin resistance drives high blood pressure. Sodium retention in the kidneys. Normally, insulin helps your kidneys excrete sodium. With insulin resistance, the kidneys hold on to more sodium and water. This extra fluid volume increases blood pressure, straining the arteries. Overactive sympathetic nervous system. High insulin levels overstimulate the fight-or-flight system. This speeds up the heart rate and tightens blood vessels. The result? Chronic pressure against artery walls. Endothelial dysfunction, blood vessel damage. Insulin usually helps blood vessels relax by releasing nitric oxide. In resistance, that function breaks down. Blood vessels stay stiff and narrow, driving pressure higher. Inflammation and fatty acids. Abdominal fat releases chemicals that worsen inflammation. This damages vessel linings and encourages plaque buildup. Stiffer, inflamed arteries can't expand easily, raising blood pressure. What's happening inside the body? Extra insulin signals kidneys to trap sodium, higher blood volume, higher BP. Blood vessels lose their ability to dilate properly. Stress hormones remain elevated, keeping the body in a semi-alert state. Arteries become stiffer, forcing the heart to push harder. Example, a 60-year-old with belly fat, borderline high fasting glucose, and hypertension may already be living with insulin resistance. Even if diabetes hasn't developed yet, the combination silently damages blood vessels and raises the risk of heart attack. The double burden of the two together. Silent progression. Both conditions often show no symptoms until damage is advanced. Higher cardiovascular risk. The combined effect accelerates plaque buildup in arteries. Worse kidney outcomes. Hypertension plus insulin resistance doubles the strain on kidney filters. Stroke risk. Rigid vessels plus clotting tendencies heighten the risk of brain injury. Why seniors should pay attention. After 50, arteries naturally stiffen. Add the effects of insulin resistance, and blood pressure control becomes much harder. This is why many seniors with normal blood sugar but central obesity or hypertension are urged to monitor both conditions closely. Insulin resistance and hypertension are not separate problems. They are deeply connected. By holding on to salt, overstimulating nerves, stiffening blood vessels, and driving inflammation, insulin resistance creates the perfect storm for high blood pressure. That's why tackling one condition often helps improve the other. Lifestyle factors that fuel both conditions. One habit, two problems. Hypertension and insulin resistance may seem like separate conditions, but in reality, they often share the same triggers. The way you eat, move, sleep, and handle stress directly affects not only your blood pressure, but also how your body responds to insulin. This is why the same lifestyle choices can worsen both conditions, and why changing those habits can dramatically improve health. Diet, the silent saboteur. High sugar intake. Foods loaded with refined sugars spike insulin levels, eventually making cells resistant. They also contribute to weight gain, which raises blood pressure. Processed foods and refined carbs. White bread, pastries, and fast food flood the bloodstream with glucose, overstimulating insulin. Many of these foods are also packed with sodium, pushing blood pressure higher. Excess salt. Processed snacks, canned soups, and frozen meals often contain hidden salt that traps water in the body, straining arteries. Low fiber intake. Without enough fiber, blood sugar spikes quickly, forcing more insulin release. Fiber also helps lower cholesterol and keep arteries flexible. Sedentary lifestyle. Sitting for long hours slows down metabolism, weakens muscles, and reduces the body's ability to use glucose efficiently. Physical inactivity contributes to weight gain and fat buildup around the belly, which fuels both insulin resistance and hypertension. Lack of exercise also weakens the heart, making it less efficient at pumping blood. Chronic stress. Stress hormones like cortisol raise blood sugar and make cells less responsive to insulin. At the same time, adrenaline and stress responses tighten blood vessels, raising blood pressure. Long-term stress creates a vicious cycle. Poor sleep, unhealthy eating, and less physical activity, all of which make both conditions worse. Poor sleep. Sleep deprivation reduces insulin sensitivity, leaving cells tired and less responsive. Poor sleep increases appetite hormones, encouraging overeating of sugary, salty foods. Blood pressure naturally dips at night, but poor or short sleep prevents this, keeping pressure higher around the clock. What's happening inside the body? Diet. Too much sugar and salt equals insulin overload, plus sodium retention equals higher BP. Inactivity. Muscles don't absorb sugar, fat builds around organs, circulation worsens. Stress. Cortisol keeps blood sugar elevated, while vessels stay tight. Sleep loss. Prevents the heart and vessels from getting nightly rest. Example. A 58-year-old with a desk job, late-night snacking habits, and chronic stress may not have diabetes yet, but these lifestyle factors create the perfect setup for both insulin resistance and hypertension. The domino effect. Poor diet plus stress equals weight gain, arrow abdominal fat, arrow insulin resistance. Abdominal fat plus high insulin equals sodium retention, arrow hypertension. Lack of exercise plus poor sleep equals lower metabolism, arrow more fat storage and higher BP. The same habits that harm blood sugar also harm blood pressure. A diet high in sugar, salt, and processed foods, combined with inactivity, stress, and poor sleep, creates a dangerous double hit: insulin resistance and hypertension. The good news is that changing these factors can reverse much of the damage. Doctor-approved strategies to improve both. The good news? You can fight two battles with the same weapons. The powerful link between insulin resistance and hypertension might sound alarming, but here's the hopeful truth. Many of the strategies that improve blood pressure also restore insulin sensitivity. Instead of treating them as separate problems, you can make lifestyle and medical changes that target both at once, protecting your heart, arteries, and overall health. Nutrition that heals both. Focus on whole foods, vegetables, fruits, lean proteins, whole grains, nuts and legumes, improve blood sugar control and reduce blood pressure. Cut down on processed sugar and refined carbs. Fewer sodas, candies, white bread, and desserts reduces insulin spikes and helps shed belly fat, a major risk factor. Limit salt, but don't fear natural flavor. Replace packaged, salty foods with herbs, spices, and fresh seasonings. Add fiber. Oats, beans, leafy greens, and berries slow sugar absorption and help lower cholesterol. Choose healthy fats. Olive oil, avocado, and fatty fish reduce inflammation and support vascular health. Exercise is medicine. Aerobic activity, walking, swimming, cycling, improves insulin sensitivity and lowers resting blood pressure. Aim for at least 150 minutes per week, broken into manageable sessions. Resistance training, light weights or bands, builds muscle, which absorbs glucose more efficiently and supports stronger blood vessels. Daily movement. Even 10 minutes of stretching or walking after meals improves blood sugar control and keeps arteries flexible. Tip: for seniors, start slow with low-impact movements. The goal is consistency, not intensity. Stress management. Breathing techniques and meditation. Calm the nervous system, lowering cortisol and adrenaline. Gentle yoga or Tai Chi improves insulin sensitivity, balance, and circulation. Hobbies and social connections. Reduce emotional stress that fuels overeating and poor sleep. Improve sleep quality. Aim for 7 to 9 hours of quality sleep. Keep a consistent bedtime. Avoid late-night eating and heavy caffeine. Create a relaxing routine. Dim lights, deep breathing, or reading before bed. Medical guidance. Regular checkups. Monitor blood pressure, fasting glucose, and cholesterol. Medications. Sometimes necessary. Doctors may prescribe blood pressure medicines like ACE inhibitors or diabetes medications like metformin. These often work better when paired with lifestyle changes. Testing for metabolic syndrome, waist size, BP, glucose, and cholesterol together give the bigger picture. What's happening inside the body with these strategies? Nutrition. Whole foods reduce inflammation, improve vessel flexibility, and balance insulin. Exercise. Muscles act like sponges for sugar, easing insulin's job and lowering BP. Stress control. Nervous system relaxes, lowering both glucose and artery pressure. Sleep. Rest resets hormones, improving metabolism and heart health. Example: a 62-year-old who starts walking 20 minutes daily, adds more vegetables, and practices deep breathing before bed can see improvements in both fasting glucose and blood pressure within weeks. You don't need two separate plans to fight hypertension and insulin resistance. A heart-healthy lifestyle, built on nutrition, movement, rest, and stress control, tackles both at once, giving you double the protection against future health risks. A daily plan for seniors at risk. One day, many benefits. Managing hypertension and insulin resistance doesn't always require dramatic changes. In fact, the most powerful improvements often come from small, consistent habits built into your daily life. Here's a simple, practical routine tailored for seniors that supports lower blood pressure, improved insulin sensitivity, and overall heart health. Morning, start the day right. Hydrate first. A glass of water before breakfast helps circulation and prevents morning BIP spikes. Gentle movement. 10 to 15 minutes of stretching, chair yoga, or a slow walk to wake up muscles and improve insulin sensitivity. Balanced breakfast. Include protein, eggs, Greek yogurt, nuts, fiber, oats, berries, and healthy fats, avocado, olive oil. This combination prevents blood sugar spikes and keeps energy steady. Midday, keep energy and BP steady. Stay active. Take short movement breaks every 1 to 2 hours. Even standing up and walking for a few minutes helps muscles absorb sugar more efficiently. Lunch plate. Fill half with vegetables, 1/4 with lean protein, fish, chicken, beans, and 1/4 with whole grains. Stress check-in. Practice 5 minutes of deep breathing or meditation to reset stress hormones that raise BP and worsen insulin resistance. Evening, wind down without spikes. Light activity after dinner. A short 10-minute walk or gentle stretches improve digestion and help keep blood sugar stable overnight. Heart-healthy dinner, soups, stir-fries, or salads with leafy greens, colorful veggies, and lean protein. Avoid heavy, salty, or sugary meals late at night. Relaxation routine. Dim lights. Avoid screens and try calming habits like reading, soft music, or guided breathing. Night, rest and recovery. Sleep hygiene. Aim for 7 to 9 hours of consistent sleep. Poor rest raises cortisol, worsens insulin resistance, and prevents BP from dipping naturally at night. Consistency matters. Going to bed and waking up at the same time daily helps regulate both blood pressure and blood sugar. Why this plan works. Hydration plus morning movement. Reduces morning BP spikes and primes muscles for glucose absorption. Balanced meals. Prevents sugar and insulin surges while providing nutrients that keep arteries healthy. Regular activity keeps circulation strong, prevents stiffness, and supports lower BP. Stress and sleep. Allow the heart and hormones to reset, reducing long-term risks. Example, a 68-year-old who starts with morning stretches, balanced meals, and evening walks may notice steadier blood pressure readings, fewer sugar crashes, and more energy in just a few weeks. You don't need to overhaul your life overnight. By building small, intentional habits into your morning, midday, evening, and night, you'll create a daily rhythm that protects against both hypertension and insulin resistance, one step at a time. Conclusion. Hypertension and insulin resistance may seem like two separate conditions, but as we've seen, they are deeply connected. Together, they create a silent but powerful strain on your arteries, heart, kidneys, and brain. The encouraging truth is that the same choices that protect your blood sugar also protect your blood pressure. By eating whole, balanced foods, moving your body daily, reducing stress, and getting quality sleep, you can take control of both conditions at once. Remember, progress doesn't come from perfection, but from consistent, small steps. Each glass of water, every short walk, and every mindful breath adds up to long-term protection for your heart and overall health. Disclaimer: this video is for educational purposes only and is not medical advice. Always consult your healthcare provider before making any changes to your lifestyle or treatment plan. If you found this video helpful, give it a like, share it with someone who needs this knowledge, and don't forget to subscribe for more doctor-approved health insights. Thank you for watching.